Welcome back, everyone, to our Lunch and Learn series for July. We have Manu from our UVA EHS department, and she is an ergonomist. Is that correct?
Yes, it is.
And she's here to talk about our UVA Ergonomics program. So, Manu, take it away.
Thank you, Mark. As to continue the introduction, I did my bachelor's in psychology and master's in human factors engineering, which is mostly about designing products and systems, and ergonomics was an integral part of that because everybody has their unique imprint, and designing products with that in mind is crucial. So this is the agenda for the session. I will talk about ergonomics, what ergonomics is, and my role at UVA, the most prevalent work-related musculoskeletal disorders, what musculoskeletal disorders are, and what are the most prevalent ones at a setting like facilities management. And then I'll go on to speak about hierarchy of controls, some ergonomic scenarios, which will be an activity-based topic, and then Q&A. To start off, what is ergonomics? According to OSHA, it's the science of fitting the job to the worker, and my work revolves mostly around that principle. So I mainly do office ergonomic assessment where I get a request for an assessment. I then determine if I need to visit the person at their office, and if a visit is needed, I observe their behaviors, make a few observations, and if any changes are required or recommendations like they need to get a palm rest or they need to move their monitor a bit closer to them, I make those sort of recommendations and I give it out in the form of an email. I also do project specific assessments. For example, I have done assessments on regulated medical waste pickup, as you can see in this picture in the center, and landscaping, custodial work, etc. I observe, analyze risk, and I make recommendations where necessary in those project-based assessments as well. The risk that I'm analyzing for is musculoskeletal disorders / injuries, and the most common ones seen in an FM-like setting are these. These are prevalent both in office workers and industrial athletes. And my objective for this slide is to spread awareness of the symptoms of these disorders. Starting with carpal tunnel syndrome, you might experience tingling or numbness in your thumb, index finger, and your middle finger. So back pain, it can be in your lower back or upper back. You might experience dull or sharp pain, and it can result in limited range of motion. Tendonitis, it's related to inflammation of tendon. You might hear me say tendon a lot in this slide, so bear with me. In tendonitis, the tendon is inflamed and you might experience pain in your shoulder, elbow, wrist, knee or heel, and you may experience warmth or redness over the tendon. The fourth one is tenosynovitis. The symptoms are a bit similar to those of tendonitis, but anatomically speaking, it's not the tendon that's affected, it's the sheath that covers the tendon that's inflamed. It's mostly due to overuse of that part of the body, and sprain and strain, the site of a sprain is the ligament which connects bone to bone, and a strain is like pulling a muscle or a tendon. So is there a way to address these issues when risk is identified? And obviously yes, it's the hierarchy of controls. It's a system for addressing the risks of musculoskeletal injuries. At the very bottom, we have PPE, which is personal protective equipment. In this case, the hazard is present and the PPE creates a barrier or a buffer between the user and the hazard. Another level, we have administrative controls. These help with changing the way the hazard is handled. It can be in the form of scheduling changes or taking breaks when necessary, techniques similar to that. And then we have engineering controls. It's a sort of a medium that helps isolate the hazard from the user. And next we have substitution, which is replacing the hazardous activity with something that's low in risk. And then finally we have elimination. These can sometimes be used in combination to take the risk as low as possible. So I wanted to explain hierarchy of controls with an example. In February this year, I met with the landscaping team, and they were focusing on I was focusing on observing them pick up gumballs. To my disappointment, these were not candy. So for those who don't know, gumballs are spiky little balls, and they can be a nuisance if they're not cleared up. So using a rake, one of these or two of these individuals, they pile up all the gumballs that they can find, and one person collects them into a bucket by hand. This activity seemed to me like it would be risky in terms of a musculoskeletal injury. So I took a few videos, analyzed them using a software called Tumike. It's an AI tool that analyzes these videos that I took and puts an animated stick figure that you can see, these orange, red, and green lines. And finally, it gives out a risk score for that activity. So how I use hierarchy of controls is knee pads and wrist braces. These can be used to create that barrier I was talking about. Knee pads, especially to create to avoid the contact stress that can be present because the knee of this individual is in direct contact with the ground. And wrist brace to avoid twisting of their wrist. But is it the most effective on its own? It's not, because these depend on the comfort level of the person who is going to use it. And it also depends on employee behavior. Sometimes people forget to put them on, or they just don't want to use them. Maybe reasons related to efficiency, it might restrict them moving in a certain way and might delay their work. The buffer zone between them and the hazard is very little, like I mentioned, so we would move on to administrative controls, which is changing the way people work. One of the strategies is to switch task routines. The individuals could switch between raking and picking up gumballs to give one set of muscles rest and engage the other set. When I asked them if they could do that, they said it's already a practice, which is great. And on its own, administrative controls also provides a buffer zone. It's a little higher than just using PPE, but if you could combine PPE and administrative controls, the risk is lowered even more. Coming to engineering controls, this device that you see is called a gumball harvester, just kind of an obvious name, but has an interesting mechanism. A person would have to walk with it like you do with a lawnmower, and the wheel with these green silicone spikes that would trap the gumballs, and the frame that you see in this picture that would help detach the gumballs, and those detached gumballs would be collected in this bin in the front. So this could remove the requirement for someone to sustain a bent back, decrease the need for raking or having to pick up gumballs by hand. Substitution as a way of reducing risk is to replace hand involvement with a squeegee broom. Remember I said the gumballs, when they are raked, they're piled up into a small little pile and the person picks it up with the hand. And if you could reduce that with a squeegee broom and nudge those gumballs into a garden bag, that would reduce the risk of musculoskeletal injuries related to the hand. And when this is combined with switching tasks or the PPE that is used, the risk is reduced 3 times. Finally, we have elimination. So casting a fruit harvesting net around the trees or the area with the greatest number of fallen gumballs will remove the need for raking or picking up gumballs by hand. And this is already practiced for olive trees to preserve the olive's quality. And for ergonomic reasons, it takes the risk of musculoskeletal injury to a whole new low. And once the net is full, gumballs can then be collected based on the capacity of the net or in equal time intervals, whichever the team is comfortable with. Now I'm going to switch gears a bit from active postures to static sitting postures. I'm going to give a brief overview about neutral sitting posture, and then in the following slides show a few pictures with people sitting in questionable postures. And you're free to point out any posture that you think is not right. So a sitting posture is considered neutral when the following guidelines are implemented, which is having your feet flat on the ground or on a footrest. The elbows, hips, and knees are between 90 to 110. You don't need a protractor to measure that. Just make sure the thighs and arms are parallel to the ground. Your wrist and arms need to be aligned and elbows close to your body. Your neck and shoulders are to be aligned and rested against the backrest of the chair. And when you're rested against the backrest of the chair, make sure the lumbar support is supporting the dip in your back. If there's one of these guidelines that a person is unable to implement, I've seen people employ compensatory behaviors. For example, if their elbows were lower than the desk surface, some people complain of shoulder or neck pain. This is because sometimes they subconsciously shrug their shoulders to pick their elbows up and use their keyboard. But using armrests could help in that case. And again, in the following slides, I'll show a few pictures. So feel free to point out anything that you see is off. Maybe something like that person isn't using armrest or their wrist angle isn't right, etc. Well, here's the first picture. What do you guys think?
It's like they're leaned forward and their back isn't contacting the chair. Yeah.
Yes. Oh, that's a very good observation. Any other observations?
They're like looking down at the monitor.
Mm-hmm.
Their knees hitting the desk.
Yeah, those are great observations. Again, the arms are unsupported. Like you said, Mark, they're slouching and the back is unsupported. The legs are folded below the chair, and that messes up the 90 to 110 degree angle. So all the individual needs to do is rest against the backrest of the chair, maybe use a footrest. Sometimes people fold their legs below the chair because the chair is too low, so they could increase the height of the chair and support their arms with an armrest. If they are having trouble viewing the screen, they could move closer or move the monitor far away, whichever they're comfortable with, so that their neck and shoulders are in alignment. Moving on to scenario 2.
That'll work.
Well, it's almost the same as the previous one. There's slouching, and the laptop is below their eye level. And they also have their legs crossed under the chair. And interestingly, if you see, their arm is in contact with the hard surface of the desk. So to counter this, you need to prop the laptop up. You can just use a few books. You don't need a laptop stand necessarily. And if you observe closely, this person used a pillow to increase the height. Because like I said, some chairs can feel low in height, and people usually fold or cross their legs below the chair because of that. And He could do a little better job of using the palm rest below his wrist so that it's not in contact with the hard edge of the desk. The next one. Ooh, okay. So yeah, I think you can see. Yeah, you can see the causes and how you can counter what's wrong with the posture this person is using. It's the arms are unsupported, the feet are dangling. You can lower the height of the seat or the chair, and if you have a height adjustable desk, you can lower the height of that desk. You can also use a chair with armrest. The next one is a bit more interesting. It's this. Anybody want to point out what's wrong with this picture? Well, imagine my dismay when I looked up computer ergonomics and pictures to put in the slide, and this is what I found. So, but on the bright side, the text in this infographic is absolutely correct. If you could just ignore the person portraying it, you could still follow the guidelines that's written in text. That's it for ergonomic scenarios. A few takeaways. Ergonomics is all about fitting the work to the worker and not the other way around. Hierarchy of controls is a system to reduce risks for a particular task, and if you want to follow neutral posture, you can just Google Ergo UVA and you will find a lot of information on office ergonomics. Any questions or comments?
This is great.
That was pretty short, but yeah.
I have to ask, where do you find most of your consultations happen? Are they individually, or do you find units calling, or how does it work?
It's a mix of both. I have individual requests that come in through a database system that we have, or somebody will, a manager or supervisor will email me asking for a chair fitting for a group of 6 people, or ergonomic assessments for a group of 6 people, some training requests. It's a mix of everything.
Sure. That's great. Do you find a common issue popping up that you see over and over again?
That's a very good question. Actually, it's mostly related to the monitor, the placement of the monitor. Some people have it too far, so that's the reason they slouch a lot, and then they have upper back pain or shoulder pain. And yeah, I asked them to follow the guidelines that are on our website. They can move the monitor closer, and the distance between them and the monitor is to have an arm's length distance so that they can view it properly and it's not too far away or too close. And that helps them stay against their backrest, and the neutral angle is automatically in place.
Sure. That makes sense.
Yeah.
Are there any other questions? Mano, thank you again. Thank you so much for presenting this fantastic information.